Good afternoon, everybody. Thank you for being here. Let's go through some data, touch on a couple things, and take some questions. Unfortunately, over the last 24 hours, we have lost a member of our community to COVID-19. 92-year-old male, pre-existing conditions, but certainly painful. And so I just want to think of him, his family, and everybody we've lost in this process, whether it's COVID-related, non-COVID related. We've all had to sacrifice. Many of us have yet to be able to really mourn and come to closure with the loss of life in this pandemic. So certainly want to think of them. This virus has impacted our seniors with pre-existing conditions. This we know. The data tells the story, unfortunately, and we need to be rigorous to make sure that we do everything we can moving forward to starve this virus and not let it attack the way it has. Looking at testing numbers from the last 24 hours, 2,227 tests in Onondaga County. So that very good testing. Again, our region's number needs to be 775 daily. We essentially are 3 times what the region number is. This helps us really identify these hidden pockets of the virus. We're still every now and then coming up with asymptomatic cases. We find them more in senior facilities, whether it's staff or residents. But by finding those asymptomatic pockets, we can then quickly quarantine, contact trace, put that aside. And because of this work, we're seeing the infection rates continue to go down little bit by little bit, and even as we've come back together. And that's what we've learned. Throughout this process, remember, we always thought in restart, each phase, things would get worse, but a little bit worse. And we had to take that risk because we had to start learning how to live with this virus and going back to work and getting our economy going. Remarkably, the community has rallied, and with every restart, things have gotten better. And that's because the community continued to do the right thing. Every once in a while, we would get off track a little bit, but quickly get on track, and it's just simply remarkable what's happened. Looking at hospitalization numbers, 14 people are in the hospital. That number's down 2 from yesterday. 5 of these individuals are waiting to return to a senior facility. They no longer need hospital care, but via the governor's executive order, they need to test negative for COVID before they go back into the senior facility. So really, when you look at the number of individuals in the hospital right now related to COVID that are being treated actively, we have 9 individuals in the hospital being treated for COVID, 3 in the ICU. So please keep these 3 individuals in your thoughts and prayers so that we can get them well, and all these folks, get them back home. But when you look at the hospital data, we haven't been here in a while. So again, our medical community is getting better at working with folks when they're sick, when they're coming in. Overall, the demographics of folks that drive hospital cases, specifically seniors with pre-existing conditions, the percentage of cases has really dropped over the last few months. And that has certainly helped us with these numbers. When we look at overall positive cases, 3,409 positive cases since March 16th. That number's up 11 since yesterday. Out of the 11 cases, 2 household contacts, 2 senior living facility, 1 case related to travel, the state of Nevada. I'm not sure where in Nevada, but I have my ideas. Origin of case yet to be determined. We have 1 still being contact traced, 5 from community spread. Out of those 5, they are all unknown sources of community spread. So again, when this happens, we get a case, we immediately do contact tracing. We have a robust team that does that, put folks into any direct contacts go into quarantine. And then certainly we then monitor those folks for symptoms. Some cases, if we think there's exposure via contact tracing that we want to get for necessary get out in front of it, we go through and we start testing. But overall, 11 cases is very good. Daily infection rate 0.49, fantastic infection rate for a community our size. 7-day average for Onondaga County 0.8. Again, just simply remarkable. It's tough to reflect back. We've been through a lot of this together. In each step of this process, we go through phases where we're talking about specific things in front of us that we need to move forward. But certainly, if you think back to April, when we didn't know where this was going, and we were totally in the response, infection rate very high, and you asked yourselves, what does our community look like at a 0.8% infection rate, something under than 1? What does it look like? Are we back? Are people back to work? Are kids back to school? I think we know what the answer is, because but now that we're here, it's still tough when we're going through different parts of reopening and going through the next steps for our community to learn how to live with this virus. Looking at active cases, we now are at 120 active cases. This is down 4 from yesterday. Certainly Tuesday's active case number of 118 was the lowest since March 26th. 120 is almost right there. Just really remarkable progress where we're getting the number of cases down so low that we're almost able to each week recover as many individuals as new cases each week. So again, I just want to thank our health department and under the leadership of Dr. Gupta and all of our amazing team with this. This is just remarkable work, and the community owes you a great deal of gratitude. Recovery is up 14. Looking at total cases to date, 1,989 female, 1,420 male, 260 under 19, 654 in their 20s, 465 in their 30s, 415 in their 40s, 507 in their 50s, 397 in their 60s, 292 in their 70s, 261 in their 80s, and 158 in their 90s. Those percentages have changed over the course of this process. Certainly, when our nursing homes and senior facilities were being hit very hard, that those cases got weighted towards the 70, 80, and 90-year-old demographics. We really made tremendous progress there. Now the cases are weighted towards our younger demographics again, as they are more social. Certainly tomorrow looks like to be an interesting day with the governor's announcements with school reopening plans. If the decision is to reopen, the governor gave guidance earlier with data metrics, 5%. If you're under 5%, you should be able to go. Again, that's his final decision. Certainly, we are under 5%, well below 5%, 0.878 7-day average, essentially 0.5 over the last 3 days. So we'll see. We'll see if the plans that were put forward get approved or if there's any modifications. Certainly, one thing we do know is that we have been working overtime, trying to make sure that when if the light is green tomorrow for school reopening, that we'll work with each district that wants help with testing employees, and then working with them with testing strategies during the year in their buildings. And so how would this happen? Our emergency management team would work with each districts with different labs and different partners of ours. They would then work with their employees, and then we would want to get the adults done first, and then move into demographics of students where we've seen cases and especially where we've seen recent cases. So certainly we all know over the 4th of July week leading into it, and that weekend we had situations where we had high school juniors and seniors and graduates socializing, and we had small little clusters that happened there. So certainly we'd want to address that. But we are ready to do this. We're ready to partner. We want to do this. How do we know that COVID's not in the buildings? We test. And there's no 100% risk mitigation plan in anything. But the lower we can get things by wearing proper PPE, by sanitizing, by testing, that puts us in a better position than the already great position we are with a 0.8 infection rate. It gets it better. So we're here to partner. Syracuse University, I've gotten some comments, obviously well reported. I'm pleased with the university cracking down on some of our young people who haven't got the memo yet that we're in a pandemic. We are working with the university very, very well on plans. There is no plan that's going to be 100% effective. And we understand that some young people will come into the community that may not do the right thing. And they may say they're quarantining, and they may end up going out on a quarantine. But what we are doing is we have a plan. We're going to enforce the plan. These young people have been tested, and they'll be tested again. For the most part, the majority of out-of-state travelers coming into the community from these hotspots are coming in on August 17th, I believe, that weekend. That does not mean there aren't people now. I've seen the same postings and everything everybody else has, but we're on it. That doesn't mean we're going to bat 1,000%. But in baseball, most people who bat 300% are in the Hall of Fame. But we're going to bat much, much higher than 300% on this. We're going to be all over this. The university has done a nice job setting the tone. We're going to set the tone. We're going to have teams that are going to go and make sure these kids are making good decisions. And then we're also, if they make bad decisions, we're going to, you break a quarantine order, you're going to get a fine. And so that's what's going to happen. We take this very seriously, and I know the neighbors in the neighborhood around the university are concerned. We take this as seriously as you do, and we're going to be all over this. So saying that, I read some reports related to some comments today related to gyms. Certainly our position remains the same. We believe gyms should be open with regulations now. I had a conversation with the Governor's Council. They told me indefinitely does not mean forever. They're still reviewing ways to do this and do this safely. I've certainly offered Onondaga County as a pilot community to do anything related to opening up gyms and or any other industry that's still closed. Let's figure out a plan. Let's figure out a way to get there. In my opinion, and the opinion of many, we probably won't get this infection rate much lower. So we need to try. We got to take a step. Some of the threats, the outside threats to our community that the governor's talked about are real. You hear him talk about travel from outside of the states and everything. That's real. We've had cases related to travel. Most of it's our residents going out to other states and coming home. But that's baked into our number. So all that threat is already in our numbers. So we still think like we can do this safely. Let's do a pilot program here in Onondaga County that the state's comfortable with to see if it works. And then certainly then if it's a model that works, the rest of the state can go and implement it. So saying that, happy to take questions.
For the SU students if they break quarantine?
I believe it would be similar to our other fines for any. It's the same across the board. If you break a quarantine right now, or whether it's in isolation or quarantine, you can get fined. So it's the same thing. We will treat these quarantines the same as a COVID quarantine. So there's a quarantine letter that these students should be getting from Dr. Gupta in our health department when they come into town. So that's something that everybody's taking this very seriously. Remember, most of these students, that doesn't mean you're not seeing students there. The students you see in neighborhoods may not be from these states. They may be from other states. They may not be from SU. There's other colleges. We're working with all of them on contact tracing, and we're working with all of them on their testing protocols. Syracuse SUNY ESF teamed up. Lemoyne's teamed up. Think about this. These kids that are coming back in, all of them are getting tested. That's not every resident. We can't say that about every resident of Onondaga County, but we can about these kids. And then the ones coming in from hot states get tested again. So that's 2 tests in a short period of time. So that's good risk mitigation. But there certainly, I've seen it. I think you've reported it. There's certainly some folks that come in. Maybe they don't understand what quarantine means. That doesn't mean you get in and hang out and go to Trader Joe's right after, right? If you need to go to Trader Joe's, there's infrastructure built up there. The university needs to help you with that. We're going to take it seriously. We're not going to have a situation pop up where we're going to see little clusters pop up because of those types of things. Eventually, Syracuse University will have a student that gets it. They're going to probably get it from living in this community. The infection rate's so low that it's probably safer for them to be here than in their own communities. But these things will happen. Just like in my own county workforce, we've had cases, right? We have a big workforce. It happened. What did we do? We responded. We quarantined everybody that should be there. They went into quarantine. We got everybody better. We get back to life. At no point did we shut down operations. So these are all things. We've been doing this for a while, so we know how to do this, and we'll get through it all.
Ryan, you mentioned again the county's working with the school districts to organize testing. And one thing I'm wondering is, will teachers and other school employees be required to be tested, and will K through 8 students be required?
Yeah, that's not my call. So I don't even think that's the district's call, right? I think if you're, and I had a couple reps from, one rep on social media reached out to me last night about testing, trying to understand that yet. We haven't connected yet. But what we will do is we will put together rapid testing infrastructure and work with the school districts, probably with our mobile testing lab, going to a district near you, right? So there may be one day we're doing 3 different districts. There may be one day where we're just doing 1 district because of how big they are. But then during that time, just like we've done elsewhere, all the employees can come and get tested. And so if you're concerned about going back to work, whether it's 5 days, 4 days, 3 days, 2 days, get your colleagues out. Make it a thing. Go. Get every employee in the building. Get every adult in the building tested. The adults have gotten it more than the kids have. That doesn't mean the kids can't get it, and that doesn't mean that if a kid has it, they can't spread it. But right now, if the kid doesn't have it going into the school year, then certainly with the other piece of this that we're talking about, Jim, is we got to work this out too. And on the backside of your question about kids, parents got to sign off on that, right? That's a parent's call. So that's going to be their call. But we want to make it available. But at first, we want to get the staff done. And then we want to do it surgically with maybe going to the demographics where we know we've seen the most cases. And that's going to be our 16, 17, and 18-year-olds. But then during the year, there's got to be something that we're going to offer, whether districts take us up on it or not, some sort of check-in to make sure things are going well. Try to find these hidden pockets, other proactive testing.
In terms of the school district employees, whose call would it be? I mean, could a district require all employees to get tested, or?
I think that would probably fall to negotiations with bargaining units. It would be certainly, I know in my own operation, there's probably certain employees I could mandate get tested. But then there's other employees that I would probably have to negotiate that with my unions. So I'm making an assumption. We know what happens sometimes when you do that. But that would be my assumption, is that this would need to be kind of a voluntary, proactive step. And if it's a proactive, smart step.
And the mobile rapid testing lab or unit, who operates that?
So we would partner with some of our partners. We would then do the testing there at the mobile testing site. The tests would then go to some of the rapid testing infrastructure we had. That rapid testing infrastructure will most likely turn those tests around within 24 hours. Then that's when certainly the tested individuals would start hearing. Back to school testing will be, from a proactive testing standpoint, our priority in county government.
Which lab is handling all the SU testing, do you know?
Syracuse University, my understanding is they used the mail-in, the initial mail-in with Let's Get Checked, I believe is that company that we've been talking to as well. They go, the test is done at home. It's then mailed back to their lab. They then get the results to a database with SU, our health department, and then when they're coming to campus, I'm not sure if they're using their own testing infrastructure or if they teamed up with Upstate or not on that. We'd have to look into that. I'm not sure. The people, when they came in on Saturday, who was testing, I'm not sure exactly who that was. But the Let's Get Checked got mailed to all the students back at their homes, wherever they live. Other questions?
Why did the town of Camilla shut down youth baseball and softball?
You'd have to ask the town of Camillus that.
Do you know who made that decision? Who would make that
The town of Camillus made that decision. So I don't know the history. Certainly, there was a couple complaints. Whenever we get a complaint about a business or an organization, no matter what it is, we're going to forward that complaint. Depending on the complaint, if it's a physical distancing issue, we then, why we're forwarding it is so that people can learn from it and get better at it. And then certainly if it's a situation where we think there's a public health risk, then that's when we go and we start the enforcement side of that. Related to this issue, I believe we saw some complaints. We forwarded it to the town. The town made a decision. It's their property.
Have you talked to the town park?
I have not specifically talked to the town directly. I'm sure members of my team have.
Can you talk a little bit more about gyms and how Onondaga County could potentially serve as a pilot community to open?
Yeah, we're a good community, a good county. We have a city, we have suburbs, affluent, working class, rural communities. So we're like New York State as a whole. And I understand that the state's struggling with this. We've been struggling with this for a while. And so I learned about the comments today. I wanted some clarification because I knew I'd be standing in front of you all. And the best I got is indefinitely doesn't mean forever, and that they're looking at ways to try to put something in front of the governor. I offered to be part of a solution. And when you look at where the data is, in hypotheticals, just the math, if you have 50 people in a room, you probably don't have COVID. That's what the data tells you. So is there ways you could do it with limited capacity, do it for a period, see how it goes, and then you move to the next step. Whatever it is, we're willing to help out in our government and regulate it and report back into the state to try to get these things open. Public health is more than COVID-19. And I know it's tough for us to remember that in this time, but right now, the mental health of the community has been challenged all over the place. It's being challenged now. Every time we have a new part of restart, people are nervous, they're anxious. Having gyms open could be very helpful for that. Certainly when we look at we've talked about it. I know that I think Jim's written stories about it, and you have all reported about our Q1 opioid overdoses. That was Q1. That pandemic was with us for 3 weeks. I'm concerned about that data in Q2. So when you have these things going on, there's this reminds me when we were pushing for churches too. Besides the fact that people need to go to church, having those voices in these hard times with the religious leaders helps the mental health of the community. The gyms do too, and you have business owners who are struggling. And I believe the data is as good as it's going to get until we have a vaccine. And this might even be the data when we have a vaccine. It might not get better than this, but we have a treatment then. That's what the difference is. So I think that we can find a way to yes, and I think we'll do anything we can to be a partner in that. Yeah. Yeah, so right now, as we speak in Washington, there's been a little bit of movement related to the stimulus bill. My understanding is that the White House has put state and local governments on the table for the first time. The number is, I think, $150 billion combined. So two things there. How much does the states get? So New York State's got their own problems. So does that mean that the state gets some money, even if it's not enough, that their cut to the county government right now and to the city government's 20%? They're saying 20% across the board. So if they get enough money that their whole now has been cut by 10%, does that mean our cut goes down 10%? That's helpful, right? The second is the rest of the locals, so cities and counties, are different in every state. Some states, cities have health departments. And in Speaker Pelosi's district, that's what her city does. Her city does a lot of the work we do. So the way this formula is structured is not necessarily equal to all governments. So in the current formula, again, that we saw before out of the HEROES Act, the city of Syracuse actually did better than the county of Onondaga. To me, does that make sense? No. We were losing more revenue. We have more costs. Am I happy for my friends in the city of Syracuse? Yes. So what does that mean? Under $150 billion, if that's the number from the states, and then the locals, we'll get something. Maybe we don't get cut as much as the state of New York. We will still need to restructure under that number. Restructure less probably, but if that number gets higher, 250, 300, 400, maybe we can survive this thing. But the when is in August. There's certainly, once we know what our number is, once we know where this is going. We got a sales tax payment notification yesterday. It was for a period of June and July, and essentially that's when phase 2 is going to phase 3. You're starting to go up. So our last payment was negative 20. That one went to negative 12.7%. So later phase 3, hopefully our next payments are more than negative 10, negative 8%. But that's a massive number. That's $45, $60 million, depending on where it all goes. So when you look at it all, what's on the table now in D.C. will help, but it won't solve our problems. So we'll wait and see. But if we know this weekend what the number looks like, if it's done this weekend, certainly the next part of the early part of next week, we'll be focusing in on the decisions that we have not wanted to make. We will make them. We'll make them quickly to send over to the legislature. Other questions? Just want to thank the community. Again, a lot of serious things going on. This is very serious overall. We've made tremendous progress. Everybody should be proud that we're doing this. A little bit of humor. Certainly, our young people who we're looking at having a very depressing week going into this week with the potential banning of TikTok. are very happy still. My daughter Maddie is very happy. Her TikTok app and videos are going on right now. I was going, if TikTok got banned, she was going to demand that I put forward some of her impersonations of some of our national political leaders, which are very funny. But it hasn't been banned yet, so my 10-year-old Maddie has not been able to twist my arm that way yet. But certainly our tweens are really, really happy this week that they still got their TikTok. So everybody please be safe.